we're focusing on the delicate skin around your eyes, an area that deserves special attention and gentle care. The skin around your eyes is different from the skin on the rest of your face. It's thinner, more delicate, and has fewer oil glands. This makes it more vulnerable to dryness, more prone to showing signs of aging, and more sensitive to harsh ingredients or rough treatment. Because of these unique characteristics, the eye area often benefits from dedicated care beyond your regular face routine. Let's understand common concerns around the eyes and what causes them. Dark circles under your eyes can have multiple causes. Genetics play a significant role. Some people simply have thinner skin or more visible blood vessels in this area, creating a darker appearance. Lack of sleep causes blood vessels to dilate, making dark circles more prominent. Allergies lead to inflammation and blood vessel dilation. Aging causes fat and collagen loss, making the area appear more hollowed and shadowed. Sun damage can increase pigmentation in this delicate area. Puffiness or under-eye bags result from fluid accumulation. This can happen overnight as fluids settle when you're lying down. Allergies cause inflammation and swelling. Too much salt in your diet can lead to water retention. Aging causes fat pads under the eyes to shift and create a puffy appearance. Lack of sleep affects fluid balance throughout your body, including around your eyes. Fine lines and wrinkles appear first around the eyes because this skin is thin and moves constantly with every smile, squint, and facial expression. Sun damage accelerates their formation. Natural collagen loss with aging makes them more pronounced. Dehydration makes them more visible. Understanding these causes helps you address them appropriately rather than expecting one miracle cream to fix everything. Now let's talk about eye creams and whether you actually need one. The truth is, not everyone absolutely needs a separate eye cream. If you're young, your skin is generally resilient and you're not experiencing specific eye area concerns, your regular moisturizer might be perfectly adequate. Many facial moisturizers are gentle enough to use around the eyes. However, a dedicated eye cream makes sense if you have specific concerns like dark circles, puffiness, or fine lines. If your regular moisturizer is too rich or contains actives that might irritate the delicate eye area, if you want ingredients specifically targeted to eye concerns, or if you simply enjoy the extra step of caring for this area specifically. The choice is yours based on your skin's needs and your preferences. There's no universal rule that everyone must use eye cream. Let's discuss what to look for in an eye cream based on specific concerns. For dark circles, look for caffeine, which constricts blood vessels and can reduce the appearance of darkness caused by visible vessels. Vitamin K supports healthy circulation and can help with vascular dark circles. Niacinamide brightens and can help with pigmentation-based darkness. Vitamin C also brightens and protects against further pigmentation. Keep expectations realistic. Eye creams can help somewhat with dark circles, but they can't completely eliminate them, especially if they're genetic. For puffiness, caffeine is again helpful as it constricts blood vessels and can help reduce fluid accumulation. Peptides support skin firmness. Cooling application helps. Keep your eye cream in the refrigerator for an extra depuffing effect. Gentle massage during application can encourage lymphatic drainage and reduce puffiness. For fine lines and wrinkles, retinol is effective for increasing collagen production and smoothing texture, but use gentle eye-specific formulations as this area is sensitive. Peptides signal skin to produce more collagen and support firmness. Hyaluronic acid plumps skin and makes lines less visible through hydration. Ceramides strengthen the skin barrier and improve moisture retention. Antioxidants like vitamin C and vitamin E protect against further damage. For general hydration, hyaluronic acid is excellent as it holds up to 1,000 times its weight in water. Glycerin is a simple, effective humectant. Squalane provides lightweight moisture. Ceramides support barrier function. Now let's discuss how to apply eye cream properly because technique matters with such delicate skin. Use your ring finger for application. It naturally applies the gentlest pressure. Your ring finger is weaker than your index or middle finger, which helps prevent tugging at delicate skin. Apply eye cream to clean skin, typically after serums but before your face moisturizer, though order can vary based on product consistency. Take a small amount, about the size of a grain of rice per eye. Eye creams are concentrated, and a little goes a long way. Using too much won't provide additional benefits and can actually cause milia, small white bumps that form when product clogs pores. Dot the eye cream along your orbital bone, the bony area that surrounds your eye socket. Place dots under your eye from inner to outer corner, along the outer corner, and on your upper lid if the product is suitable for that area. Gently pat the product into your skin using your ring finger. Don't rub or pull. Pat, 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 moving from inner corner outward and upward. This gentle patting motion helps with absorption without traumatizing the skin. Avoid getting product directly on your eyelid margin or too close to your lash line. Product can migrate into your eyes, causing irritation. Stay on the orbital bone area. Apply eye cream morning and night, or just at night if you prefer. Consistency matters more than frequency. Some people enjoy using an eye serum underneath their eye cream for extra treatment benefits. If you do this, apply the serum first, let it absorb, then apply your eye cream to seal it in. Let's talk about what to avoid in the eye area. Never pull, tug, or rub the skin around your eyes roughly. This delicate skin doesn't bounce back well from trauma. Always use gentle patting or pressing motions. Be cautious with harsh active ingredients. While retinol can be beneficial for the eye area, use formulations specifically designed for this sensitive region, or use your facial retinol very carefully, avoiding the immediate eye area. Avoid getting facial products with strong actives directly in the eye area unless they're specifically labeled as eye safe. AHAs, BHAs, and strong vitamin C formulations might be too irritating for this delicate skin. Fragrance and essential oils are common irritants. In eye products especially, fragrance-free is often safer. Be careful with sunscreen around the eyes. Some sunscreens sting if they get into eyes. Look for mineral sunscreens or those labeled as suitable for the eye area. Wearing sunglasses provides extra protection. Now let's discuss additional ways to care for your eye area beyond just product application. Sun protection is crucial. The skin around your eyes is vulnerable to sun damage. Wear sunscreen daily, carefully applied to avoid eyes, and wear UV protective sunglasses when outdoors. Sunglasses also help prevent squinting, which contributes to wrinkle formation. Stay hydrated. Dehydration makes fine lines more visible and can worsen dark circles. Drink adequate water throughout the day. Get sufficient sleep. 7 to 9 hours allows your body to repair and reduces puffiness and dark circles. Elevating your head slightly while sleeping can help prevent fluid accumulation that leads to morning puffiness. Manage allergies. Welcome to this peaceful space of learning and care. Take a deep, nourishing breath, hold it for just a moment, and then release it slowly. Let your shoulders drop. Let tension melt away. Today we're going to talk about something absolutely fundamental to skin health that doesn't get nearly enough attention: your skin barrier and how to keep it healthy and strong. Your skin barrier is the unsung hero of your skin's health. It works tirelessly, 24 hours a day, protecting you from the outside world and keeping your skin functioning optimally. Yet it's often invisible in its work. You only really notice it when it's damaged and stops working properly. Today, we'll learn to understand, appreciate, and care for this remarkable protective system. Let's begin by understanding what your skin barrier actually is. Your skin has several layers, and the outermost layer, the one you can see and touch, is called the stratum corneum. This is your skin barrier. Think of it like a brick wall. The bricks are dead skin cells called corneocytes, and the mortar holding them together is a mixture of lipids, ceramides, cholesterol, and fatty acids. When this wall is intact and strong, it performs two crucial functions beautifully. First, it keeps the good things in: water, moisture, and the structural components that keep your skin healthy. Second, it keeps the bad things out: bacteria, irritants, pollutants, and allergens. A healthy barrier means healthy, comfortable, resilient skin. When this barrier is compromised or damaged, everything changes. Water escapes more easily, leaving your skin dehydrated. Irritants penetrate more readily, causing sensitivity and inflammation. Your skin becomes reactive, uncomfortable, and unable to maintain its optimal state. Many skin concerns that seem unrelated actually stem from barrier damage. Let's explore what a healthy skin barrier looks like and feels like. Healthy barrier skin feels comfortable. It's not tight, not itchy, not irritated. It feels soft and supple to the touch. When you apply products, they absorb comfortably without stinging or burning. Your skin tolerates changes in weather reasonably well. It doesn't react dramatically to most products. It maintains its moisture throughout the day without becoming excessively dry or oily. It has a natural, subtle glow, not oily shine, but healthy luminosity. Healthy barrier skin also recovers well from minor insults. A pimple heals without becoming a major drama. A slight scratch or irritation resolves quickly. Your skin has resilience and bounce-back capacity. This resilience is the hallmark of a strong barrier. Now let's understand what damages your skin barrier, because prevention is always easier than repair. Over-cleansing is one of the most common culprits. When you wash your face with harsh cleansers, use very hot water, or cleanse too frequently, you strip away the natural lipids that form your barrier's mortar. Your skin's pH also becomes disrupted. This leaves your barrier weakened and porous, unable to retain moisture or protect adequately. Overexfoliation is another major cause of barrier damage. In our quest for smooth, glowing skin, many people use exfoliating products too frequently or too aggressively. Physical scrubs, chemical exfoliants like AHAs and BHAs, and exfoliating tools all remove the surface layer of your skin. Used judiciously, this can be beneficial. Used excessively, it destroys your barrier faster than your skin can repair it. Environmental stressors take their toll as well. Cold, dry winter air, hot, dry indoor heating, air conditioning, sun exposure without protection, wind, pollution. All of these assault your skin barrier daily. While you can't avoid all environmental stress, you can minimize exposure and support your barrier's ability to withstand it. Harsh products with irritating ingredients also compromise your barrier. High concentrations of alcohol, fragrances, essential oils, and certain harsh actives can all irritate and damage your barrier over time, especially if your skin is already compromised. Using too many products, even if individually gentle, can overwhelm your skin. Each product requires your skin to process and respond to dozens of ingredients. When you layer many products, you're asking your barrier to handle hundreds of ingredients at once, which can weaken it through sheer overwhelm. Stress, poor sleep, and inadequate nutrition affect your barrier health as well. Your skin barrier repairs itself primarily while you sleep. When you're chronically sleep-deprived, this repair process is compromised. Stress increases inflammation throughout your body, including your skin. Poor nutrition deprives your skin of the building blocks it needs to maintain its barrier. Now let's talk about how to keep your barrier healthy through daily practices and choices. The foundation of barrier health is gentle cleansing. Choose a mild pH-balanced cleanser that removes impurities without stripping your skin. Your cleanser should leave your skin feeling clean but comfortable, never tight or squeaky. Avoid cleansers with sodium lauryl sulfate, which is particularly harsh. Use lukewarm water, never hot. Cleanse thoroughly but gently, without aggressive scrubbing. Most people only need to truly cleanse once per day, in the evening. In the morning, many skin types can simply rinse with water. This prevents over-cleansing and preserves your skin's natural oils. Moisturize faithfully and appropriately. Your moisturizer is your barrier's best friend. It provides both hydration and the lipids your barrier needs to function optimally. Look for moisturizers containing ceramides, which are a key component of your skin's natural barrier. Fatty acids, cholesterol, and niacinamide are also excellent barrier-supporting ingredients. Apply moisturizer to slightly damp skin. This helps seal in that extra water and supports your barrier's hydration. Don't be stingy with moisturizer. Use enough to cover your face and neck comfortably. Protect your skin from the sun every single day. UV radiation damages your barrier directly and creates inflammation that weakens it over time. Broad-spectrum sunscreen is essential barrier care, not optional. Be extremely cautious with active ingredients and exfoliation. If you use retinoids, AHAs, BHAs, or other actives, introduce them slowly and use them sparingly. Start with once or twice a week and only increase frequency if your skin tolerates it well without irritation. Never use multiple actives at the same time or on consecutive days until your skin has proven it can handle each one individually. Consider taking breaks from actives periodically to let your barrier rest and repair. Your skin doesn't need constant treatment with powerful ingredients. Sometimes it just needs gentle support and space to maintain itself. Layer your products thoughtfully. Thinner, water-based products go first, followed by thicker, oil-based products. This allows each layer to penetrate appropriately. Give each product a moment to absorb before applying the next. Rushing and layering too quickly can prevent proper absorption and overwhelm your barrier. Support your barrier from within. Drink adequate water throughout the day. Eat foods rich in omega-3 fatty acids, salmon, walnuts, flax seeds, which support your skin's lipid barrier. Ensure you're getting enough essential vitamins and minerals, particularly vitamins A, C, and E, and zinc, all of which support skin health. Prioritize sleep. This is when your barrier repairs itself most effectively. Aim for 7 to 9 hours of quality sleep nightly. If you're consistently sleeping less, your barrier will struggle to maintain itself regardless of what products you use.
Many people use ketoconazole shampoo on body areas, lathering and leaving it on for 5 to 10 minutes before rinsing. Ketoconazole is gentle and suitable for frequent use. Zinc pyrithione is another topical antifungal commonly found in anti-dandruff shampoos. At 1 to 2% concentration, applied daily, it reduces malassezia and can improve fungal acne. Like ketoconazole, it's gentle and suitable for long-term use. Selenium sulfide is a strong topical antifungal traditionally used for fungal skin conditions. At 2.5% concentration, available by prescription, applied daily, selenium sulfide effectively treats fungal acne. However, some people find it irritating or have sensitivity, limiting its use in some cases. For extensive fungal acne or fungal acne resistant to topical antifungals, oral antifungals may be necessary. Fluconazole is a systemic antifungal taken orally. Typical dosing for fungal acne is 50 to 100 mg daily for 2 to 4 weeks, or alternatively, 200 mg weekly for several weeks. Oral fluconazole effectively treats extensive fungal acne and reaches areas topical antifungals cannot. However, oral antifungals can have side effects and require more medical supervision than topicals. Itraconazole is another systemic antifungal option, sometimes used as an alternative to fluconazole. Dosing and duration vary based on specific protocols and severity. Additional strategies for fungal acne management include addressing contributing factors. Wear breathable, moisture-wicking clothing. Shower promptly after sweating. Keep skin clean and dry. Use gentle, minimal skin care. Avoid heavy oils and occlusive moisturizers. Live and dry environments when possible or use a dehumidifier. These environmental modifications reduce conditions favoring yeast overgrowth. Niacinamide may provide supplementary benefit for fungal acne, as it has mild antifungal properties and reduces sebum production. Including a niacinamide product in your routine might provide additional benefit alongside topical antifungals. The challenge with fungal acne is that it can recur if contributing factors aren't addressed. If you treat fungal acne successfully but then resume wearing tight synthetic clothing in a humid environment, fungal acne may recur. Long-term management might involve occasional use of topical antifungals, weekly or monthly, to prevent recurrence. If you've been treating acne without improvement for several weeks or months, ask your dermatologist about fungal acne. A simple KOH preparation takes minutes and can confirm or rule out malassezia. Don't waste time on ineffective antibacterial treatments if you have fungal acne. Appropriate antifungal treatment provides rapid improvement. Guide 25, Acne in Different Life Stages, Adolescent, Adult, and Menopausal Acne. Acne presents differently and requires different approaches depending on life stage. Understanding age-specific acne characteristics and treatment approaches ensures appropriate management across different ages. Adolescent acne, occurring during puberty, is the most common form. Hormonal changes during puberty, particularly increased androgens, trigger increased sebum production, making adolescent acne typically more oily and comedone-prone. Adolescent acne often affects the T-zone, forehead, nose, chin, particularly heavily. Peer influence, stress about appearance, and psychological impact are often significant. Most adolescents can manage acne with topical treatments alone, though moderate to severe cases may require oral antibiotics or hormonal treatments, particularly girls. Treatment approach for adolescent acne emphasizes prevention and establishing good habits. Starting with gentle cleansing, topical treatments, and sun protection during teenage years establishes habits that persist into adulthood. Most adolescent acne improves or resolves as hormonal stability is achieved in late teens or early 20s, though some individuals continue experiencing acne into adulthood. Adult acne, occurring in adults beyond teenage years, has different characteristics. Adult acne is often more localized, jawline, chin, lower face, and frequently hormonal in nature, particularly in women. Adult acne is often more inflammatory than comedonal compared to adolescent acne. Stress, hormonal cycles, skincare product irritation, and lifestyle factors play larger roles in adult acne than in adolescent acne. Adult acne is sometimes attributed to skincare products or cosmetics, acne cosmetica. Adult women with acne often benefit from hormonal evaluation and hormonal treatments. Oral contraceptives or spironolactone can provide significant improvement. Additionally, adult women should evaluate whether acne patterns correlate with their menstrual cycle, as this suggests hormonal involvement. Adult male acne is less common than in adolescence but does occur. When it persists into adulthood, it's often quite severe and may warrant aggressive treatment including isotretinoin consideration if not responsive to standard treatments. Occupational factors sometimes contribute to adult acne. Individuals with occupations exposing them to oils, chemicals, or heat, mechanics, cooks, healthcare workers, sometimes experience acne from occupational exposure. In these cases, addressing occupational factors, protective equipment, skin cleansing protocols, helps alongside medical treatment. Menopausal acne occurs in perimenopausal and menopausal women due to hormonal fluctuations. As estrogen levels decline and the ratio of androgens to estrogen increases, acne can develop or worsen. Menopausal acne often presents as deep, cystic lesions on the lower face and chin. Hormone replacement therapy, HRT, during menopause can help manage menopausal acne, though it's a complex decision requiring discussion with your healthcare provider about overall health implications of HRT. If HRT isn't pursued, topical treatments and oral spironolactone are options for menopausal acne. Many menopausal women find that aggressive topical treatment with retinoids and benzoyl peroxide adequately controls acne. Stress management and lifestyle optimization become increasingly important during menopause. Pregnancy acne occurs in some pregnant women due to hormonal changes. Treatment options are limited during pregnancy because many acne medications are contraindicated. Isotretinoin is absolutely contraindicated due to severe teratogenic effects. Retinoids are generally avoided. Oral antibiotics like doxycycline are contraindicated. Spironolactone is contraindicated due to potential effects on male fetus development. Safe treatment options during pregnancy include topical benzoyl peroxide, topical azelaic acid, topical salicylic acid, though large-scale systemic absorption is theoretically possible with large area application, and it's best used sparingly, and possibly topical clindamycin. Most women manage pregnancy acne with these limited options, prioritizing safety. Some pregnant women actually experience improvement in acne due to pregnancy hormonal changes, while others experience worsening. Postpartum acne sometimes occurs as hormones shift again after delivery. This usually resolves within several months, though if breastfeeding is occurring, some hormonal factors may persist. Standard acne treatments are generally safe while breastfeeding, though some medications require careful consideration. Discuss specific medications with your healthcare provider if treating acne while breastfeeding. Age-related changes in acne treatment tolerance are important. Adolescent skin is generally very resilient and tolerates aggressive treatment well. Aging skin becomes more sensitive and drier, requiring gentler treatments and more aggressive moisturizing even if using the same medications. An adolescent might tolerate 2% salicylic acid daily with minimal dryness, while a 45-year-old woman with the same treatment might experience excessive dryness and irritation, necessitating reduced frequency or concentration. Transitional acne between